Hello friends, good morning. Today in continuation of topic peripheral nerve, we discuss about myelin sheath. What is myelin sheath? Its function, salutatory conditions, clinical aspects. So let us we start myelin sheath. In this diagram, you see myelin sheath which covers the axon or presents outer layer of the axon membrane. Most of the nerve fibers are covered with a sheath of lipid and protein substance called myelin. Myelin sheath is made up of lipid and protein substance which covers the nerve fiber called myelin or myelin sheath. The myelin sheath is formed by sheath cell. The sheath cells are Schwann cells in the peripheral nervous system and oligodendroglia in the central nervous system. Sheath cells are called or named Schwann cell in the peripheral nervous system and oligodendroglia in the central nervous system. Schwann cells are not present in central nervous system. Nerve fiber covered by the myelin sheath appear white in color because of the fatty nature of myelin. These fibers are called myelinated nerve fiber. Myelin sheath is formed by sheath cell. Sheath cell called Schwann cell in peripheral nervous system and oligodendroglia in central nervous system. So according to presence of or according to space or present or location of the myelin sheath, name is changed or different. Schwann cells are not present in central nervous system. It only present in peripheral nervous system. Nerve fiber covered by the myelin sheath appear white in color. Myelin sheath is white in color due to fatty nature of myelin. These fibers are called myelinated nerve fiber. Functions of myelin sheath. The myelin sheath increase the velocity of conduction of impulse. Its function is increase the velocity of conduction of impulse. Due to the presence of myelin sheath, less energy is spent in the process of conduction. Myelin sheath act as insulation sheath for individual nerve. So function of myelin sheath is increase the velocity of conduction of the impulse. Salutatory conduction. What is salutatory conduction? The myelin sheath is regularly interrupted along the length of axon by nodes of Ranvier. This arrangement greatly increases the speed at which nerve impulses are conducted. In human, 80 meter per second. So velocity of the nerve conduction, velocity of impulse conduction in human is about 80 meter per second. This happens because of nodes of Ranvier. The signals jump from one myelinated node to the next. This process is known as salutatory conduction. So salutatory conduction is the transformation or transfer of impulse from one node to next node, and node of Ranvier help in the transfer of the impulse or signals. In non-myelinated nerve fibers, the action potential passes continuously along the axolemma. The passage of nerve impulses is slow, about 4 meters per second in this type of nerve fibers. So in normal nerve fiber, impulse velocity of impulse is 80 meters per second, and non-myelinated nerve fiber, the action potential is 4 meters per second. Clinical aspect. In clinical aspect, demyelinating disease, in which demyelinating disease of myelin sheath are known, which may demyelinate the nerve fiber, thus interfering with the conduction of impulse. The most common these diseases include multiple sclerosis, Tay-Sachs disease, and Guillain-Barré syndrome. So, first is multiple sclerosis. You see the appearance of this patient. In multiple sclerosis, the most common autoimmune disease of myelin sheath triggered by a viral infection. Multiple sclerosis is the most common autoimmune disease which is caused by or triggered by the virus. In this disease, the myelin sheath degenerates and myelin is removed by microglial cells. Once demyelination occurs, conduction of nerve impulse along the nerve is affected. Guillain-Barré syndrome. In this diagram, you see in green color distal limb weakness phenotype of Guillain-Barré syndrome or GBS. Frequency of disease is 7.5%. Causative factor Campylobacter jejuni. Clinical aspects or sign symptoms: antecedent diarrhea, mildly disabled with treatment of mainly hand weakness, partially preserved DTRS, normal protein level in cerebrospinal fluid, positive anti-ganglioside, axonal or RCF pattern. So, in Guillain-Barré syndrome is characterized by progressive demyelination symptoms. This disease results due to malfunction of the immune system. Next, Tay-Sachs disease. Tay-Sachs disease is a hereditary or autosomal recessive disorder. It results from abnormal accumulation of glycolipid called GM2 or ganglioside in the myelin sheath. As GM2 or ganglioside accumulates, it disturbs the conduction of impulse. The patient suffers from blindness, loss of coordination, and dementia. Next is heavy metal poisoning. Heavy metal such as mercury, arsenic, and lead are known to produce damage to the glial cells and produce demyelination in central nervous system and peripheral nervous system. This produces both sensory and motor symptoms. How a disease affects in heavy metal poisoning: due to occupation or occupational effect, environmental, dietary, or medicine. This all exposure affect the human and affect the system, brain, liver, kidney, blood, skin. Free radicals, enzymatic and non-enzymatic defense, oxidative stress, lipid protein, DNA, DNA damage, DNA repair, apoptosis, failure, carcinogenicity. So, how a cancer develop in a person? In lipid, cell membrane damage, and in oxidative stress, protein enzyme inhibition, inactivation of regularly proteins, conformational changing. So, in this way, heavy metal poisoning affects our life or myelin sheath. Diphtheria. Diphtheria is a bacterial infection of respiratory tract. In addition to respiratory symptoms, the powerful bacterial toxins also damage Schwann cell and destroy the myelin sheath in the peripheral nervous system. Both motor and sensory functions are affected, leading to paralysis. So, complications of diphtheria in paralysis. So, today we see in continuation of peripheral nerves, myelin sheath, what is myelin sheath, functions, salutatory conduction, clinical aspects. In next topic, we see about or discuss about the classification of the peripheral nerve system. So I request to all viewers, like, share and subscribe my channel and give a comment or any inquiry or doubt related to this topic. Thank you for